our paper with you. As Sadia mentioned, it's called Understanding the Chronic Pain Journey and Coping Strategies that Patients Use to Manage Their Chronic Pain, a qualitative patient-led Canadian study. I'm just going to share my slides. There we go. Excellent. Our paper was published in BMJ Open in July of 2023, so just a few months ago. And we would like to acknowledge that we're presenting on behalf of our co-authors, Elena Lopatina, Karen Moffat, Sophia Kahn, Pamela Pyle, Sherry Kashuba, Tracy Wazalek, and Dr. Maria Santana. In our paper, we also acknowledge the contributions of Dr. Tamara McCarran, who was an instructor and mentor for this work, and also the patients who helped design the study and the patients who participated in the study. And finally, Alberta Health Services Strategic Clinical Networks, who sponsored our work. I understand that we have people participating today from across the country. I decided to share this beautiful University of Calgary slide as a land acknowledgement. However, instead of reading it out, since we're a collection of inquisitive minds, I wanted to challenge you to consider why we include land acknowledgements in our presentations and what truth and reconciliation means to you. I put the link to the University of Calgary's Path to Reconciliation on the slide, but since you probably can't type all that out so quickly, you can find it by just Googling UCalgary land acknowledgement. When I include a land acknowledgement in my presentations, I like to take the opportunity to reaffirm that I'm committed to learning more about the past and the path towards reconciliation in my work and in my personal life, and I challenge you to do the same. Before we get into details, I thought I'd just provide you with a brief overview of our presentation today. We will take you through our paper and share some of our key learnings, and then my understanding is that we'll have time for questions and discussion, which we are very much looking forward to. To provide some context for our project, it was a PACER student project. PACER stands for Patient and Community Engagement Research. And for those of you who may not be familiar with it, it's a one-year certificate program offered by the University of Calgary Continuing Education Department, and it's supported by the Alberta SPORE Support Unit. PACER teaches people with lived experience of a health condition or as a community member to conduct qualitative health research. It's a team-based program, and the team for this specific project was focused on the topic of chronic pain. In PACER, we often say by patients, with patients, for patients, and I thought it would be fun to show you the self-portrait of the team of patients who I had the pleasure of working with as they conducted this research project as part of their PACER internship. I was their team support, and I worked hand in hand with them on their project, and I'm lucky enough to call them all friends today. Now I'm going to hand it over to Jamie, one of the painkillers, to share some additional background, the study objective, and to discuss our methodology with you.
Thank you, Marcia. I also am very happy to be here today and to co-present what we did with Marcia. So chronic pain, as you can see, is defined as a pain that occurs in one or more places in the body and persists or reoccurs for longer than 3 months. It's often invisible and can affect people throughout their lifetime. It is also associated with significant emotional distress and functional disability that interferes with performing the activities of daily life. Symptoms of chronic pain, we found, vary, but as illustrated on the slide, can include fatigue, insomnia, changes in activity level, frequent need to rest, weakened immune system, disability, and mood-related disorders. It is truly an invisible illness. The objective then of our study was to gain insight into the coping strategies that people living with chronic pain use to self-manage their pain on a day-to-day basis. As a patient-led study, we thought it was really important to fill a gap that we saw regarding how patients manage their self-pain, and we identified that gap through literature surveys prior to focusing in. Our aim overall was to inform healthcare professionals in particular about what it is like living with chronic pain from a patient's perspective, to offer them some insight into important considerations for when they are developing treatment plans or recommending coping strategies during a patient's chronic pain journey. And you'll see in a moment why that's important. So the PACER approach consists of three phases, excuse me. Before embarking on these stages, our team conducted a literature review that included both academic and gray literature to understand gaps and focus ourselves to a specific area of chronic pain management. So the first phase, shown in blue on this slide, is a set where we co-designed the research study with other patient partners who had lived experience of the condition being studied. In our case, we worked with 3 individuals with chronic pain experience to co-develop our research question, scope, and project plan. After receiving ethics approval for our study materials, we then moved into a collect phase, shown in green, where we collected data using focus groups and individual interviews. In our case, we had 1 focus group with 6 participants, and we conducted 5 individual interviews. Then, with the information that we collected during the focus group and interviews, we analyzed this data using thematic and narrative analysis. Finally, in the reflect stage, shown in orange, we invited our patient participants from the collect phase back to review our preliminary findings and provide input before finalizing our findings and recommendations. And I should just say that after we analyzed the data using, as I said, thematic and narrative analysis, we developed and listed our preliminary findings, and that's what we just shared with the participants in the reflect stage. After we met in finally focus group and reflected with our patient participants, we wrote a final paper, which eventually was edited into the publication that we are sharing with you today. Just to give a sense of the people who participated in the study, we thought we would share our inclusion criteria and recruitment strategy. So we included people who had lived with chronic pain for 2 or more years, were over the age of 18, and who lived, and importantly, who lived in Alberta. We used purposeful sampling through a number of local support organizations that we were a part of, and these included Genuvius, the Chronic Pain Center Collaborative Membership Network, Helping Ease Alberta's Pain and Alberta's Health Services Strategic Clinical Networks. Carrying on, I'm going to turn over the presentation to Marcia again.
Great, thanks, Jamie. Although the research question that was defined in our set phase, so in the very beginning, was limited to daily coping strategies of people living with chronic pain, during our collect phase, as participants shared their coping strategies, the conversations went well beyond coping strategies to include the elements of chronic pain and the chronic pain journey to acceptance. Participants stressed the importance of understanding the whole picture when determining coping strategies. So 3 main themes emerged from the data. First of all, the elements of chronic pain. Second, the chronic pain journey. And the third one was the daily coping strategies for chronic pain. Participants thought it was important to discuss all 3 of these themes together because the daily coping strategies that they employed at any given time, which was theme 3, depended on the factors that were discussed in theme 1 and theme 2. Also, I just wanted to point out that as I'm presenting, you will see quotes from our participants in italics on the slide. And I just did that so that you can hear directly from our patients and our participants as we present the results. Theme 1 reveals the elements of chronic pain. Chronic pain impacts every aspect of a person's life. When we reviewed our findings, as Jamie mentioned, with participants during Reflect, they agreed that the elements of chronic pain together form the chronic pain form the chronic pain experience, which could be represented as branches of a tree. It helps show how complex living with chronic pain is. Whether you're concerned about your future and how you're going to pay your bills, or take care of your family if you can't work, or if you're navigating a complex healthcare system where you have to constantly advocate for yourself, all of these elements take a toll and impact how you will need to cope with your pain on a day-to-day basis and the implications that it will have on your life. As illustrated in this figure, Theme 2 shows that diagnosis was pivotal for people suffering from chronic pain to be able to cope and take control. Prior to diagnosis, individuals experienced huge and unpredictable emotional swings as they struggled for answers. Diagnosis allows people suffering from chronic pain to start taking control of their life by making modifications to their lifestyle and begin getting the support that they need. Although there were still some swings after diagnosis, in the second part of the journey, the swings became less pronounced as the patients started to accept their new normal and to have a better understanding of their limitations and what strategies they could use to help them cope with their pain on a daily basis. An important thing to note here as well is that the grieving process is throughout. Both of our Collect and Reflect focus groups were very emotional. Our whole team was struck by this grieving process that kept coming up as people living with chronic pain talked about their journeys. Many of our team members had also experienced it themselves, but it came out so clearly as we worked with our participants. It is important to note that the grief doesn't just happen once. It can emerge sometimes over and over again on their chronic pain journey. One of our participants related it to the grief of losing a loved one. Our third and final theme summarized the daily coping strategies that our participants used to manage their pain. It included things like exercise and trying to stay mobile, and seeking the right team of medical professionals to support them, including listening to their body and knowing when to take a break, and having access to the right supports and mental health resources. It was great to see participants sharing tips. For example, they talked about the advantages of using Tylenol arthritis versus regular Tylenol for the slow release and longer pain relief. During our focus groups, participants even exchanged contact information in the Zoom chat so that they could continue sharing their tips and names of their doctors and places where they got certain medications after our focus group. It was really a great place to be and a really collective knowledge building experience. Another underlying theme throughout was the need to be your own advocate and to fight to be seen and heard. Our participants also helped us come up with these recommendations during our Reflect focus group when we brought them all back together. First, they believed that chronic pain treatment should include multidisciplinary care. For example, it should include doctors, physiotherapists, occupational therapists, psychologists, dietitians, naturopaths, and chiropractors. They suggested that doctors should encourage people to seek support, whether from a person or support groups, as well as mental health supports. They believe that care should be holistic and include preventative strategies, such as peer mentoring, exercise, and mental health supports, and not just reactive solutions like medication. They stressed that mental health support was critical and that mental health support should include grief support. They wanted to see chronic pain guidelines created for both doctors and patients with information on how to understand and treat chronic pain. And finally, they recommended that doctors receive further training on chronic pain so that they're better able to understand and support patients. It is also important to note that our team and the patients that came, or the participants that came back for our Reflect, recommended that people living with chronic pain should be involved in that training so that doctors could hear directly from the patients what it's like living with chronic pain and how it affects so much of their lives. To the best of our knowledge, this was the first patient-led study to offer insights into the interplay between the chronic pain journey and coping strategies used by patients. The study also found that understanding the elements of chronic pain and the chronic pain journey to acceptance are important precursors to being able to use the better known and more well-documented coping strategies. We found lots and lots of questions, or lots of papers on coping strategies, not necessarily self-management coping strategies, but a lot of them didn't discuss this whole piece of how that fits into how someone living with chronic pain exists. As you saw in the recommendations, the patients who were part of our study want their healthcare providers to be trained in what it's like to live with chronic pain and to look at the person and the impacts of that pain holistically. In conclusion, chronic pain is complex and often invisible disability. Chronic pain affects all aspects of a person's life and involves a grieving process. When treating patients with chronic pain, it's important for healthcare providers to understand the journey that a person living with chronic pain goes through. Diagnosis is critical for the patient's acceptance and in helping them find their new normal, where they can work with their healthcare team to employ daily coping strategies to help manage their pain. Thank you for your time and for allowing us to share what we learned from our participants. The Painkillers and myself continue to be involved with Alberta Pain Strategy so that we can help influence the implementation of the recommendations from our study where possible. We look forward to any questions that you have today during the discussion. And thank you again to our co-authors and sponsors of this work. It was a very emotional, but very fulfilling journey for our team. And we were happy to do the work. Thank you very much.